Hey everybody, I am back with our favorite psychologist and trauma specialist, Dr. Alexa Altman. Thanks for taking time for us.
Love to be here.
So we are going to talk about EMDR. I have talked about it, this is like years ago. I think it's probably like 4 or 5 years ago. I talked about what EMDR is, but as an EMDR specialist, Alexa here is going to debunk some of the myths, help us better understand and answer maybe some of those questions that we have about it, maybe reasons we haven't started. Let's get into it.
Yeah.
So for people who don't know, let's just open with what is EMDR?
Yeah. So EMDR stands for Eye Movement Desensitization and Reprocessing. It's a long name. Francine Shapiro in the early 80s. It's a famous walk in the park. She was walking, she had a distressing thought, and she noticed while she was walking, right, left, moving her feet, that as she was thinking about the distressing thought, that the distressing emotions and some of the sensations and some of her thoughts around what was distressing started to move down and come down in intensity. And so she started to experiment with, wait, what if there was something about this right-left movement of my walk that's helping release some of the emotion charge with this distressing event? So she started experimenting with her colleagues and some of her patients, and she put together this theory that there's something about bilateral movement. In this case, it was eye movement. So she noticed during the walk in the park, her eyes would move back and forth, kind of like REM sleep. And she thought there was something to the back and forth movement that happened involuntarily.
Interesting.
So she started to experiment and noticed that the eye movement back and forth created an opening in the nervous system and started to regulate the nervous system. There's lots of theories as to why that eye movement regulates the nervous system. One theory is that it opens a neurofiber bridge connecting the right side of the brain and the left side of the brain. And we know when traumatic events happen that the thinking part of the brain shuts down. And so therefore it's very hard to reprocess an event that the thinking brain has been shut down.
Interesting. I didn't think about it that way, but yeah, we do know that when like our limbic system is triggered and our amygdala is like running the show, that our prefrontal cortex, like all of the forward-thinking, organized thought offline, like adult part of our brain.
That's right. That's right. So she discovered that the eye movement was critical in the reprocessing of traumatic events.
Interesting. Okay, cool. So that's a little bit about EMDR. And like I said, I have a video where I walk through all of the findings and like where it came from, how we do it, and we'll get into more of that stuff as well. But we're going to walk into some questions, commonly asked questions. We're going to FAQ style.
Yes.
So what's the first most commonly asked question?
I think what I get the most in my clinical practice is, will it erase my memory? Because we are working with early traumatic memories or sometimes recent traumatic experiences, and it cannot erase in a memory. What it does is it reduces the emotional charge, or maybe the sensations attached to a memory or the triggers attached to that memory. So what people often report is that the memory becomes neutral. It happened and it's in the past.
It's like the way we talk about like any regular day, right? If somebody asked about what I did yesterday, I'd be like, oh, we cleaned out the garage and we packed some boxes. It doesn't have any, it's just kind of is.
That's right.
Right, or I made breakfast, I watched TV. Nothing, neutral.
Right, and the memory then also has like a beginning, middle, and end. And in traumatic memories, oftentimes it doesn't have a beginning, middle, and end. It actually feels like it's still happening. So to really have a recognition that it's in the past, I actually feel like it's a consolidated memory. It's in long-term memory where it belongs.
Yeah.
Another big one that I get is it hypnosis?
Oh yeah, because I do have to be honest, as someone, I knew some people who were thinking of going to school and we were studying together who ended up going into the hypnosis route. And I'm like, you guys know, I mean, I don't knock it if it helps you, it helps you, but I'm like, it's not, I don't believe in it. So EMDR is not hypnosis.
It's not hypnosis. I think a hypnotic trance, an altered state, sometimes people doing eye movement can feel like they're in a hypnotic state. We would then alter, and we'll talk more about that, different kinds of bilateral stimulation. But the goal is not actually to enter a hypnotic state. The goal of it is actually to support a relaxed state, a safe state, so you can safely process a traumatic memory.
Yeah, so staying calm, because I've talked to them a lot. My audience knows that if you dissociate a lot, EMDR doesn't, it's not that it won't work for you, but you have to be present.
Correct.
To be able to do the processing.
That's right.
So we don't want you in an alternate space.
Right. EMDR, they talk a lot about dual awareness, that the idea of dual awareness is that I can have one foot in the present moment and one foot in the past. And that we have to be able to have both, that dual awareness, in order to process effectively.
Yeah,
You
makes
want
sense.
to lose yourself into the experience. That is actually another question I get. Will EMDR re-traumatize me?
Yeah, because I'm always like to guess ahead of time because I don't know the answers to these.
Yeah.
But I would think that EMDR could, if not done properly, which I feel like therapy can do the same. Like if I take somebody on as a patient and they need more trauma work than I have the wherewithal to understand and do, I could push them too fast, make them talk about it too much, and potentially re-traumatize them. Is that true?
Yeah. So I think really what you're getting at is right on, which is the preparation. And if EMDR is the right form of therapy and the right time in therapy. So an EMDR trained therapist will go through a very long, extensive history with a person to discover their trauma timeline, what kind of coping skills, their ability to be present in the moment. Is a person safe? Safe with themselves, or is their environment safe? Because EMDR therapy does elicit strong traumatic memories or strong emotional memories, and really need to be able to have that kind of affect tolerance, ability to really tolerate high affect states. And that's really for the therapist to assess with the client. There's also some other conditions in which EMDR could potentially be ineffective or re-traumatize a patient. If somebody comes in and they are currently using drugs or alcohol, if they are suicidal, unstable, it's not a good idea to begin EMDR treatment in that way.
Well, you can't tap into the trauma. Like if you're supposed to be present currently and have a leg in past or in whenever the trauma occurred, if you're not even able to handle the present at all, how could you go back to something that feels worse? Do you know what I mean?
Right.
Like that doesn't,
That's right.
it's counterintuitive.
I think about it often like a pool, like a swimming pool. You're not going to swim to the deep end unless you can swim back to the shallow end.
Yeah.
Right? You don't want to get in too deep. EMDR therapy has a history of or people come in thinking it's an incredibly cathartic therapy. It can be. It also can be done a little bit at a time. I think pacing, based on where the therapist feels a client's readiness to really go into the worst part of an experience. So it's really a dance between the therapist and a client. The other thing is preparation. Some clients need months of preparation. We'll get into that in a little bit later. But really to feel like a person can ground and feel safe in the present moment, in the rapport also with the therapist.
Yeah, and I know that from my audience, they told me a lot of them are in trauma work or trying to do EMDR and they're doing the prep work. And they're frustrated because they expected it to go more quickly. And, then they're being told, oh, we can't do EMDR today. I don't think it's right yet. And it's like, but I want to get through this. And I understand, like, I don't want to feel like shit any longer than I need to.
Yeah.
But you're saying that it's part of that. What I always think of therapy is like an art form because you do have to kind of read your patients, also read your own ability to, like, where are we at looking at their resources or assessing them. And like that push-pull of like, I'm going to challenge you, but I want to push you past where you're able to go. Like, I don't want to push you too far in the pool. I want to make sure you can swim back.
Right. We have a range of resilience, and we have to stay in that range to get, I think, an optimal outcome. People come in with the idea, because early research in EMDR with one single incident traumatic event, in the research it had 3 sessions of EMDR. And there was significantly, statistically significant change. However, most EMDR treatment is not 3 sessions. And people ask all the time, how long is this going to take? Which therapists don't like that question.
No, because you don't know.
You don't know. And it's not like we're trying to be evasive. We really don't know.
Everybody's different. Some people might take 7 sessions. Some people might take 22.
Right.
Runs the gamut.
Does somebody process quickly?
Yeah.
Do they have just a ton of coping despite
their resilience? Like I remember last time we filmed on the whiteboard, or no, we did like the paper. And the making the resilient zone is like this middle, and then this would be like the fight, flight, and freeze kind of state. And some people's resilient zone is this big.
Right.
Some people's resilient zone is this big. And
right.
It's like
And you sometimes don't really know that till you start working in a person's system.
So you see how long they can withstand the stress. Really.
Right. That's part of that dance. So I think setting some realistic expectations, I think, is really helpful. Anybody who's thinking about starting EMDR therapy. It's also can be used by itself. Some therapists really, I don't know many that just do EMDR. It's usually within a variety of different trauma modalities that we've talked about, somatic experiencing or brain spotting, psychomotor, sensory therapies that I think not everybody's can process with EMDR. And so it's nice to be able to work with somebody who might be able to offer some other strategies, other techniques.
Definitely. Because as we know, or when I was researching for my book about trauma, I learned that it's usually a combination that's best. Because we used to think, talk therapy, putting it into a narrative form, giving it a beginning, middle, end, super therapeutic, can be healing. Yes, but not for everybody. Some people need an additional component like an EMDR, or some people need a different modality like schema, somatic experience, things like that. I do have a question actually, because recently someone asked me about brain spotting. Do you know what it is and how it's different? Because
yes,
I looked up a little bit. It was on a live stream. If you guys are on my Patreon, I looked it up and I said, from what I can read, it sounds similar to EMDR.
So I'm trained in brain spotting, so I know quite a bit about it. It's was created by David Grand, and it was initially he developed it to enhance sports performance. But what he discovered is, I'm going to try and just say it in a succinct way, is that the eyes are kind of the windows to the soul, right? That our eyes are also the window into our nervous system. And Francine Shapiro, who developed EMDR, was onto something with the eye movement. With brain spotting, you actually find different spots within the visual field. When a person talks about a traumatic experience, you track where in the visual field holds the most charge.
Oh, interesting.
So it's a way into the charge of a traumatic event through the eyes.
Interesting.
And what I like about it is it's can be less activating than some of the bilateral stimulation.
Okay.
You kind of get to hold people in that kind of charge a little bit longer and a little steadier. And for some patients, they just respond positively to it.
Well, everybody's different, right?
That's right.
Some people might respond more quickly to EMDR.
That's right.
Or versus brain spotting or vice versa.
But they're very similar in that they have a similar approach to get into the memory network, which is what we're doing in EMDR and brain spotting. And they have similar strategies as far as once you're in the memory network, it's a lot of free association.
Okay.
Which we can get into a little bit
Yeah,
more.
what are the other questions we want to answer?
Okay.
Have we missed any?
EMDR, is it only good for PTSD?
That's a good question. My hypothesis would be that no. It's good for a lot of things.
A lot of things.
Because I've even wanted to try it out myself.
Yes. Well, I think it's a really good idea because it can address common issues such as, a stress response in response to maybe get triggered at the office by your boss and you don't know why, or panic attacks or addictive disorders.
Urges, impulsivity. Yeah, and that triggered, because we always talk about it like, we've talked about this when it comes to like family members or other people are like, I don't know, they just know how to push my buttons. But like, why and how do we not be as reactive?
That's right.
Yeah.
Right. And you can know better. And yet
Doesn't mean you do better.
Right? You have a physiological response, and maybe you know where it comes from, and maybe you have some ideas about that. So EMDR is great at kind of bringing that material up and uncharging it. I always think of it like draining a battery. Feels like it really drains the system of whatever that charge was. And sometimes, like we talked about in other videos, that charge is like I go into fight or flight. Or sometimes it's, I just space out. I just go into freeze and dissociate. Yeah. EMDR, you can use EMDR if you dissociate. We just have to work with, again, staying in that present.
Yeah, interesting. That's good to know, though, because I think a lot of people have wondered, would it help me with this or that? And it's not just, even though we talk about it specifically with trauma, because it has so many applications in that way, it can also be applied in many others.
Another question just came up for me is, what if I don't have a memory, like a visual picture memory?
Yeah, because repression's real. And then people worry that they're then going to be, memories are going to be placed into their brain, which I know sounds crazy, but we've heard about it. It was like in the 80s, I remember this being a big thing, but
so what we know is that sometimes there isn't a visual memory. Maybe you have a sensation that comes up or an emotion that comes up, like when you're with a person, right? And you don't know why. The thing with EMDR and processing stored memory or stored traumatic experiences is sometimes I can process a whole piece with a person and it's just somatic. So meaning just sensation, there never is a full story. And we have a lot of different theories about that. Some theories are it was a preverbal experience, maybe birth, maybe within those first 2 years, and we can resolve a whole piece of work and never have the picture of the whole narrative, and it doesn't matter.
Yeah. That's interesting, because I think a lot of people do struggle with that, like not having that full memory and feeling like they need to have it in order to process it. But it's almost just, in a way, the way that I think about it is like, it's not so important that we remember everything. It's important that we resolve what's bothering us now.
Right. Yeah, that's a great point. EMDR is very symptom focused in the sense of, yes, it's important that we know what trauma experiences you had, but what are your symptoms that we're really trying to relieve? And that's what we're tracking the progress. As much as we're tracking, did we drain that battery of the emotional pieces, we're also tracking, are you having symptom relief? At the end of the day, that's what we want,
Yeah,
right?
because we want to feel better. That's the goal, which I think is why people find so much efficacy and so much, I don't know if it's like resolve or relief from EMDR.
Right. Yeah, I think that for me as a clinician, what felt when I first learned EMDR felt magical. I was just to witness something starting at a 10 or a 9 as far as subjective units of distress, and it moving to a 1 or a 0 within, again, a few sessions. I can't say when the person's totally relieved, but just to witness change like that in a therapeutic setting from a clinical perspective, I'm not even suggesting from the patient, but from a clinical perspective is really profound.
Yeah, because we don't get to see that all the time. I think as a non-EMDR based therapist, it's those aha moments where then you're like, it's funny on the therapist side of things, you think like, I am good at my job, because we can have really tough sessions with patients where there's no progress, they're very frustrated. We feel that with them, and then you have those, and then yay, we knew it was working, we just had to push a little bit harder. And so it can be really rewarding. I think one question a lot of people have had recently is, because of COVID-19 and virtual sessions, can EMDR be done virtually, not in person?
Yes. Some of the challenges that can be with remote is I think it takes a little bit longer to build rapport with a therapist if you haven't met with that therapist prior to being remote. So that preparation phase might be longer, but you absolutely can do EMDR remote. And if you were in-person session, the way that the therapist creates that bilateral stimulation is, and maybe if you've seen a video online or somebody's looked, the first kind of way we introduce EMDR is actually with the eye movement, which you can do remotely too via Zoom. It can be a little more awkward. So the eye movement, can I show you what it looks like?
Yeah, I'd love it.
Okay, so we're just going to turn towards each other.
Okay. I'm going to move you a little bit, buddy. I'm sorry.
So typically in a live session, if we were... we've already done the intake and we already kind of have decided that you're going to start EMDR therapy. The first thing we do is discover together what kind of bilateral stimulation you're most comfortable with.
Okay.
So we try on a bunch of stuff.
Okay.
And you get to just see what it feels like. And then also, we're not married to any which one way. So
you can like switch in and out, whatever.
Any point. So the first one I usually start with is the eye movement.
Okay.
And we would actually typically sit maybe not quite this close, but a little further away.
Closer than normal therapy, kind of. Not like across
it is closer. And if you've been in traditional talk therapy, that's a big change. So I'm just going to put my fingers right about here, and I'm just going to start very slowly, just to feel what that's like. And then you let me know.
I find it soothing in general. Good. But I think because it's like I don't have to focus on anything else.
Yeah. And does my finger feel too close? Okay. And how's the pace?
It's probably good, but I don't think I could go any faster.
Okay.
Is that normal?
Yeah. So typically when we do the resource installation phase of EMDR, which is in the preparation, we do slower eye movements.
Okay.
And 6 to 12. And the reason we start slow and short is we want to stay in the positive. If you stay too long, sometimes it can flip to the negative.
Got you.
Yeah.
Okay, interesting.
And then the other direction we're going to try is diagonal.
Oh. I didn't even think about this, that it'd be different.
So just notice which one.
Yeah.
The difference is, your comfort.
Yeah.
What do you notice?
That one isn't as comfortable. I don't know why, but it's just like I feel it here. Is that, I don't know.
Right. Well, that's the thing is, it's just your own subjectivity and where you feel like you can kind of sit in it a little bit deeper. The thing with eye movement is your eyes have to be open. So these other ways to stimulate that bilateral stimulation, you can close your eyes or open them. So it gives you some choice. The next thing we're going to try on are these tappers.
Let's give them a go.
Okay. And similarly, we can adjust the speed and the intensity.
Okay. I like it more intense.
Okay.
I like it kind of, because I can really feel it then.
Okay. So
the lower. Interesting. I feel like this is weird, you guys, and I have no idea. I've never actually done this before, but I feel like if it was lower, it like forces me to focus on it more, which I don't know if that's a good thing or a bad thing. It might be a helpful distraction.
So I tend to think actually of any of these different forms of stimulation as like anchoring and grounding of attention. People often describe the tappers, or we'll get to the tones in a second, as like, oh, it gives me something else to focus on.
Yeah.
So I'm not all the way in the story.
Because if it's too intense, then I don't have to focus on it that much.
Good.
I can like focus on,
Right.
So if it's light, then I have to, I don't know. It's weird.
Yeah.
But that's interesting.
Yeah. So that's the tactile, the tappers. Okay. And then another form, you get so many choices.
I know.
Is
there's
auditory tone, and then there's auditory music. But sometimes you'll hear an auditory beep. That moves right, left, right,
so
left.
So it's just moving the sound from one ear to the next?
Right.
Interesting.
And so we can turn the volume up.
Again, I think like same with the tappers.
Okay.
It'd be a nice distraction if I had to focus on it. And so I had to like listen. One of my, I know we see you, Leo. One of my favorite lines I read in Where the Crawdads Sing was squint with your ears. Sometimes I feel like when you really have to listen hard, I would like to like squint with my ears more so that I could distract.
Right. Stay in the here and now and in your senses. What I notice the bilateral stimulation does for me as a clinician or when I'm receiving EMDR is it does force attention to really stay in the here and now.
Yeah.
So whatever stimulation you feel most grounded or most present with, that would be the one I would advise people to choose.
Okay. Yeah, I think we'll try the self one, and then I'll decide which one I think would be the best.
Okay. In an office, I'll do one more version of tapping. In an office, a therapist could tap on a client's knees as another version. I'll show you what that looks like. Okay.
And you have to get really close then, that way.
Yes.
Right? Which might be uncomfortable for some people.
So what I was going to say, if you have a history of sexual abuse or a history of any kind of physical assault, probably wouldn't advise this way. Why? I think sometimes it can be very useful. Somebody's had early developmental trauma and not had a lot of nurturing contact. Sometimes that light touch can feel very nurturing.
Yeah, very healing.
Yes, healing.
Interesting.
Right.
Okay.
So that's very, particular to the person. So the tapping, it just looks like this. And then you can tell me lighter, softer, harder, faster.
I think that pacing's good. And I think the good, amount of touch, I guess. Not harder or softer. I think that's nice. Okay. I still think I like the eyes best. But yeah, this isn't bad either. I think it's kind of nice in the same way. We'll have to see when I do it myself, but just that I don't have to do it is nice.
Right.
Whereas the eye movement, you do kind of have to participate.
Yeah.
So I don't know. There's a lot of thoughts with I'm sure, and I might switch between.
Right.
I could see myself being like, oh, today I'd feel like touch or taps or whatever.
Right. Or maybe a particular intensity of an experience. You really want something that keeps you here in a different way. Yeah.
That's interesting. I never thought about that at all.
Yeah. Right. There's so many, what's helpful is it's very unique to the person and that you can really have an experience of getting to know your nervous system also through that. Oh, this helps me soothe. This helps me calm.
Yeah.
It's also an amazing strategy and skill to use outside of session.
Well, yeah, because then you could, okay, so let's talk about how I can do it so that we can do it outside of session. We can sit this down.
Okay. So what I might do in a remote session is I would teach people the butterfly hug. And you can also teach this to children, or with children, sometimes you can do even another version, but I can show you that one. So the butterfly hug looks like this. You're going to cross your hands, and you're just going to tap back and forth on your shoulders. And then again, you can play with pace and intensity. For some people, if this feels like uncomfortable and like tight, you could tap on your own knees.
Okay.
Just another version. So let's just see what you notice.
Yeah, I think this does feel a little tight to me. I don't know what it is, which I could see people finding it comforting. Sounds like a hug.
Yeah.
But I think the legs is better. Yeah, and I still, the basic eye following your fingers is actually, I think, the best for me personally.
Great. So it's just, that would be, I think, just as far as like after the preparation, part of the preparation is establishing what kind of bilateral stimulation are we going to do? So the thing that happens in a remote session, because that's where we're kind of going, with the eye movement, sometimes a therapist on a Zoom can do that. Yeah. Or a client can pick 2 spots to move back and forth between.
Oh, okay, like lamp keys.
That's right.
Just boop, boop, boop.
That's right. Before I had this one caveat I have in doing an EMDR session video is, please do not try EMDR at home by yourself without a trained clinician. That it really can open up material, and it's really helpful to have the setting, the person, the relationship, all the skills in place to safely process.
Yeah.
So what we can do at home, though, is really discover how to install positive resources, positive states. And that can be incredibly useful, like if you decide to move into EMDR therapy.
Gotcha. So when we are, trying to put in those positive resources, we're still doing the tapping.
Correct.
Or whatever, right? And that's how we're like putting them in.
Correct.
Gotcha.
Yes.
Just for people to
them.
understand. Yeah, installing. That's the word.
Installing them.
Well, thank you. That was really helpful. And actually answered some questions that I had, since you guys know I don't specialize in EMDR. So if anybody out there is curious about it, maybe wanting to start it, where should they start?
Yeah, that I think the first step would be to go to the EMDR website, and I think it will be in the link below. What's wonderful about now that we can work remotely is you don't have to have an EMDR therapist in your hometown in order to start EMDR therapy. They can be licensed in your state, and so that's no longer a barrier to care.
Yeah, it's wonderful for rural people because they can find someone, as long as they're in the same state, you can find someone. So yeah, we'll link all that stuff in the description. Thank you again. And we're going to be doing other videos together. So make sure you're subscribed and have your notifications turned on, because we'll be debunking other things, talking about EMDR in a deeper way. And also I'll be practicing a little bit. We'll see what it's like to actually do it. Thank you so much for watching, and we'll see you next time. Bye.